Hi, thanks for joining us for our 2015 coding updates for neurology and neurosurgery. There are not a significant volume of changes or new codes. There's a couple of deletions that we'll make you aware of, but this should be fairly quick and simple and easy. So I am going to go ahead and let Candice get started with the coding updates, and I will chime in when and where appropriate.
Thanks, Josh. So our 2015 neurology coding updates. Our first one is our evaluation and management services. We have a new code, code 99490, which is for our chronic care management services. This is a remote code. It's considered as a telehealth service, so a patient does not have to be present at the time. In order for us to use this code, we must meet at least 20 minutes clinical staff, direction by the physician, per calendar month, 2 or more chronic conditions, and those conditions expecting to last at least 12 months or until death of the patient. CPT codes 22510 to 22512 replace CPT codes 22520 to 22522. These new codes have the same description as the old codes. The only thing that has changed is it now includes imaging guidance.
So we've created a breakdown for you, the provider, or you, the administrator, to see what happens when they take 2 codes that you used in 2014 and combine them into a single code. There's also a reduction in RVU value versus what used to be 2 codes. So you can see the difference in the reimbursement is quite significant. It's less in 2015 than it was in 2014. So this is something to be aware of based on your volume of vertebroplasties, and just note the revenue shortcoming that you'll experience this year versus last year.
Next slide, CPT codes 22513 to 22515 replace CPT codes 22523 to 22525. These new codes also have the same description as the old codes. The only thing that has changed is now it includes imaging guidance.
And again, we've done the same comparison so that you can see the changes in reimbursement when you build 2 codes in 2014 versus a single code in 2015. Again, there's a significant decrease in the reimbursement, and this is something to take note of whenever you're comparing revenue on these CPT codes this year versus the 2 CPT codes last year.
CPT code 61334 has been deleted, foreign body removal. We still have codes 61332 and 61333, which is the same approach, so you want to focus on those codes. Also 61440, 61470, 61490, and 61592 have all been deleted.
When the AMA chooses to delete these codes, it's normally based on usage, so there must not have been usage. You may be looking at these thinking those are outdated procedures or that they're not commonly performed anymore, and that would be the main reason for the AMA deleting these codes.
Our skull base surgery add-on code 61609 has been deleted. However, we still have add-on codes to choose from, 61610 and 61611, with the same similar descriptions. CPT code 61875 has been deleted. For a cranioectomy procedure, use CPT code 61870. Repair code 62116 has also been deleted. For a repair code, you could use CPT code 62115 or 62117. Spine and spinal cords. We have 4 new codes, which are radiographic exams with contrast to detect pathology of the spinal cord by spinal region. So we have code 62302 for cervical, 62303 for thoracic, 62304 for lumbar, and 62305 for 2 additional regions. Our radiology codes 72291 and 72292 have been deleted. They're inclusive components to several surgery codes. Those surgery codes are the ones that we saw on slide 2 and 4. Modifiers. The description for modifier 59 has been revised to see all level 2 HCPCS modifiers. These modifiers are known as XEPSU modifiers. They are located in your HCPCS 2 code. The new X modifiers are a breakdown of modifier 59. The reason why CMS has established 4 new modifiers is to allow providers to explain the reason of a distinct procedure service.
And CMS considers modifier 59 to be overly utilized because it bypasses the claim audit system used by CMS and many other carriers. The good news for you practices that are using NewportMed and we're currently coding your surgical cases is that we will be responsible for adding these new modifiers, but we do want to draw your attention as the documenting surgeon that we would like you to keep these definitions, mentally keep them so that you can include a little bit more detailed information as to why certain procedures are separate from one another. We always want you documenting the separate nature, but if you would consider using some of the wording here, whether it's separate encounter, separate structure, separate body part, or it's an unusual service that you're performing in addition to the primary procedure, that would be great. It'll allow us to appropriately add the correct X modifier. This is something new, so we want to make sure we get it right the first time, and making sure your documentation is clear will be a big help. So, believe it or not, that sums up any and all changes for neurology and neurosurgery. We believe that there were minimal changes this year, primarily because the implementation of ICD-10 is coming for October of this coming year, and that will be some big changes. We do have some expertise on ICD-10. If you have any questions, need help with implementation, have coding discrepancies, please contact Candice or myself, and we'll be happy to help you.